Who knew? Good evening. It's a rare opportunity to have a chance to introduce your mentor, the person whose personality, values, skills inspired you to do what you do with your career. And I have the chance to do that tonight. Dr. McClelland attended the University of Texas. He wished he'd gotten into Baylor, but he was not accepted. That's right. Yeah, not everyone can come here. He attended University of Texas Medical Branch at Galveston. He did surgery residency at Parkland Hospital in Dallas. I would read to you his publications, but it's 10 pages of, I think, single-spaced information. Dr. McClelland was the Alvin Baldwin, occupied the Alvin Baldwin Chair of Surgery for Surgical Education at University of Texas Southwestern Medical School for countless years. He's an adjunct faculty member at SMU, and he's Professor Emeritus of Surgery at the University of Texas Southwestern Medical School. He has influenced the lives of literally thousands of physicians all over the world. Was the editor of Selected Readings in General Surgery, which is a review of the entire world's medical literature every 5 years. Beyond all that, he's a kind, wonderful, humble man. Dr. McClelland had I might add that it's been a number of years since I trained. You might can tell that I still know his home phone number. In fact, I confirmed it on the internet today. Dr. McClelland had either the good fortune or the bad fortune to be in the emergency room at Parkland Hospital on November 22nd, 1963. He's one of the few surviving physicians that cared for President Kennedy, and then he operated on Lee Harvey Oswald 2 days later. He also was a witness in the Warren Commission report, and obviously has spent a fair amount of his life influenced by what happened to him that day. So with no further comments, I'd like to welcome Dr. Robert McClelland.
Thank you, Dr. Nielsen. And he said I was a good mentor. He was a good mentee, if there is such a word as that. And I remember him very, very fondly with all of our contacts. And that's been one of the great blessings of my life, is knowing people like him. I was trying to figure the other day about how many medical students at Southwestern that I've had something to do in the many years that I was on the faculty there with their training. And I think it's somewhere a little over 12,000. And about 3,000 surgery residents of various kinds. So I was really honored and blessed to have that contact with all of those people. And anyway, so that brought me also into contact with what I'm going to talk about tonight. And I always think of the description of someone who's giving a talk or a lecture, that it has 3 parts. You tell them what you're going to tell them, then you tell them, then you tell them what you told them. I'm not going to do all of that. I'm going to try to kind of smoosh it up together. And what I'm going to start out with, and hopefully leave some time for comments or questions, is to start out where I was, just because I can know about that and I can't know about where other people were. But on November the 22nd, about noon, 1963, I was in the operating room at Parkland in one of the conference rooms showing a movie to several of the senior surgery residents about how to repair a hiatus hernia. And in the midst of that movie, I heard a little tap on the conference room door, and I went to the door and looked out, and standing there was Dr. Chuck Crenshaw, Charles Crenshaw, who was another one of our senior surgery residents at Parkland. And he said, "Dr. Mack, would you step out here for a minute? I need to tell you something." So I went in and shut off the movie projector, stepped back out, and Dr. Crenshaw said they've just called the emergency room and said that President Kennedy had been shot during his motorcade downtown, and they're bringing him into the emergency room now, and they want all of the surgery faculty people to come down to the emergency room immediately. Well, at that time, our surgery faculty consisted of 4 people. Now it consists of 56, I think. And so, having heard that, Dr. Crenshaw and I walked to the elevator there in the operating room, rode down to the emergency room 2 floors below the operating room at Parkland. And on the way down the elevator, we were trying to cheer ourselves up and saying hopefully that, well, we hear about a lot of bad things coming into the emergency room sometime, and actually when you get down there and see what it is, it's not as bad as it was purported to be. Well, with that, the elevator doors came open in the emergency room into a large area. There's nowhere near as large as this, but it was pretty big. It was a big area, about 50 feet on each side, surrounded by patient examination cubicles. And when I walked out into that large area, I saw something I'd never seen there before, and that is that it was filled with men in business suits, newsmen, I found out. And they were packed in there as tightly as you could get. And I'd never seen that, and I wondered what that meant. And then as I stood there and took that in, the crowd somehow or other managed to part and form a little corridor, like down the line of chairs here, to an area off of the emergency room, a little hallway, and on each side of that hallway there were emergency operating rooms 1, 2, 3, and 4. And sitting outside of emergency operating room number 1 on a folding chair was Mrs. Kennedy in her bloody clothing. So I thought to myself, my God, this is really what has happened. And there she is, and there the president is in trauma room 1. It also, I knew that my chief, Dr. Shires, was in Galveston at a meeting, and so he was not in Dallas. And I didn't know where my 2 associates, Dr. Malcolm Perry and Dr. Charlie Baxter, were, but I thought they might be out of the hospital trying to find a hamburger rather than the hospital food at that time. So that meant I might be the only surgeon there. And I had to force myself to keep walking back toward where Mrs. Kennedy was sitting, and standing outside where she was sitting was Mrs. Doris Nelson, who was a nurse in charge of the emergency room. And she was standing between 2 Secret Service men, letting them know who to go by into trauma room 1 and who not to let go by. So she waved me on through, and they said go on by, the Secret Service men. And I pushed the door open to trauma room 1 and was immediately saw the horrific sight of the president lying on a cart there in trauma room 1 with an operating room light shining down on his bloody head. That picture is still emblazoned in my mind to this day. And so I walked on in, but I was also gratified to see that I wasn't by myself, that my associates, Dr. Perry and Dr. Baxter, had walked into the room just before I came in. They had also been told what happened. And as I walked in along the left side of the cart, Dr. Perry was over on the other side of the cart about to explore a wound in the president's neck, about where I'm pointing my finger. And he said to me, he said, Bob, there's what looks like an entrance wound in the president's neck just to the right of his windpipe and just above his collarbone on the right side. And we're going to explore that because we're worried about whether his carotid artery, the blood supply to his brain, was injured. And anyway, Dr. Perry said, would you take this retractor and go and stand at the head of the cart and lean over, and we're going to enlarge the hole and explore it and look at the vessel and then perform a tracheostomy as we get through. The president had his trachea intubated with an endotracheal tube the minute he came into the emergency room, and the very first physician who saw him was a surgery resident who was in charge of the emergency room all the time during that time, and that was Dr. Jim Carrico, who subsequently became the chief of surgery at the University of Washington, and then the chief of surgery in our department until he died, unfortunately, not too many years ago. But at that time, he was a resident on duty in the emergency room and was the very first physician who saw the president and intubated his windpipe at the moment he came into the emergency room. And then he was transferred back into Trauma Room 1 where we saw him. So anyway, I walked by the president. Dr. Perry handed me this retractor. Dr. Baxter was standing on the other side, opposite where Dr. Perry was, and I went and stood at the head of the cart the president was lying on. And when I got up there, I was horrified again to see the president's head. And I said to Dr. Perry and Dr. Baxter, I said, "My God, have you seen what happened to the back of his head?" And they said, "No, we hadn't had a chance to examine him except to see this wound in his neck." And I said, "Well, the whole back part of his head on the right side has been blown out." And I could actually look down into his skull cavity and see that the back half of his right cerebral hemisphere was gone. And in fact, as I stood there, the right half of his cerebellum, the lower part of his brain, fell out of his skull onto the cart. So it was obvious that he had a fatal wound, that there was nothing that could be done. Nevertheless, Dr. Perry and Dr. Baxter, with me helping them retract, completed what they were doing, taking only about 5 minutes. And at the end of that 5 minutes, Dr. Clark, who was our neurosurgery professor at Parkland and at Southwestern Medical School at that time, had come into the room and was standing next to the electrocardiographic monitor that had been attached to the president. The president had excellent cardiac activity on that monitor when he came in and was even making attempts to breathe, despite the nature of that injury to his brain. But the lower part of his brain, the brainstem, was probably allowing him to continue to make efforts to breathe. Well, after about 5 minutes, Dr. Clark looked at the electrocardiogram and saw that it had lost all of its activity. It had straight lined. So he said to Dr. Perry, "Dr. Perry, you can stop now," or he said, "Mack, you can stop now because he's gone, the president is gone." And so with that, everybody stepped away from the president, and a crowd that had accumulated in Trauma Room 1, everybody began to surge out of the room. In so doing, Dr. Baxter and I got trapped between the cart the president was lying on and the wall of Trauma Room 1. So we had to stand there as everybody else left. And finally, when they left, we were the only ones left, and we began to push the cart away to make our exit. But before we could do that, the door to Trauma Room 1 came open again, and a priest came in who had been called to administer last rites to the president. We later found that his name was Father Huber. And so he came in, and again, we would have had to push him out of the way to get to the door to leave Trauma Room 1, so we once more froze against the wall and found ourselves, we felt inappropriately but couldn't avoid it, being present for the president's last rites. And Father Huber came over, uncovered the president's face with a sheet that had been pulled over it, anointed his forehead, and I couldn't hear him say but the first phrase or so when he leaned over to the president's left ear and said, "If thou livest," emphasizing the if. And then he dropped his voice and I couldn't hear the rest of what he said, but he completed that and was getting ready to leave himself when the door came open again to Trauma Room 1, and Mrs. Kennedy came in again and stood across from Dr. Baxter and me and next to Father Huber, and she spoke in such a low voice, soft voice, that I couldn't hear what she said, to Father Huber, but clearly from his answer, I knew she had asked if the president had received last rites. And Father Huber said to her, "Yes, I have given him conditional absolution," sort of emphasizing the conditional. Mrs. Kennedy heard that and she grimaced. She didn't like hearing that word conditional. But she didn't say anything, and she stood there for a moment and exchanged a ring from her finger to the president's finger, and a ring from his finger to her finger. That's about all I can remember how to describe it. Then she stood there for a moment longer and didn't say anything, was very self-contained, most dignified lady I've ever seen. She was in complete control, obviously very upset by this, but not hysterical. I mention that because the recent movie Parkland that I saw a couple of weeks ago had her in hysterics and throwing her body over the president's body, and she didn't do anything at all like that. She was a very dignified, contained person who was grief-stricken, obviously, but not to that extent that she was losing control of herself. Well, she stood there for a moment after she made that ring exchange, walked to the end of the cart where the president's bare right foot was protruding out from underneath the sheet that he was covered with. She stood by his bare foot for a moment and then leaned over and kissed his foot and walked out of the room. And that's the last we saw of her, Dr. Baxter and I. And we left the room after she left and went back upstairs to the operating room and sat down next to the nurses' station in the operating room, Dr. Baxter and Dr. Clark and all the doctors that were in the room there. And we sat there, and as we were sitting there, two Secret Service men came by with pads of progress notes from the hospital, and they asked each one of us to write down what we had done just now, while it was fresh in our minds. So each one of us wrote out what we saw and what we did there and gave that back to the Secret Service men when they came back in a few moments and collected those statements. As we were sitting there, Dr. Rose, who was our forensic pathologist at Parkland, and whose office was down also on the bottom floor next to the emergency room in Parkland, he came up and joined us there in the operating room outside the nurse's office and sat down with us and told us what he had just seen. Dr. Rose was sitting in his office and he had a window looking out of his office onto a long corridor that led out to the loading dock at Parkland. And as he sat there, he looked up and saw this little procession coming down that corridor. And it was the president, who had now been placed in a coffin, and he was on the same cart that he was on in Trauma Room 1. And they were pushing that gurney, that cart, down toward the exit to an ambulance that was waiting outside to take him back to Air Force One and back to Washington. Well, when Dr. Rose saw that, he stepped out into the hallway and held his hand up to the two Secret Service men who were leading that little procession. Dr. Rose said that one of the Secret Service men was carrying a Thompson submachine gun. The other one was unencumbered by anything, and Mrs. Kennedy was walking along the side of the cart, and several of the president's friends, Kenny O'Donnell and others, were on the other side of the cart as they were rolling it out to the exit. Dr. Rose said, "I'm required to tell you that any murder that's committed in the state of Texas, the victim must undergo a postmortem exam in this state." Well, Dr. Rose said nobody said anything, but the Secret Service man who was unencumbered by the machine gun came over to Dr. Rose and very gently put his hands underneath Dr. Rose's armpits, lifted him up off the floor, and set him over against the wall of the corridor and shook his finger in his face, and then they turned and proceeded on out to the ambulance that was waiting there at the end of the loading dock and went back to Love Field and then back to Washington from there. But they had no intent of leaving the president there for postmortem. So that was pretty, Dr. Rose was pretty shaken up about that, but that's what happened. And so basically that's what happened that we saw at Parkland on that day in regard to the president. The next day, Saturday, nothing happened. Of course, everybody was upset all over everywhere, and the television and the radio had nothing on them except things about the assassination. And this was, that day passed, nothing happened. And the next day, my children, 2 small children, and my wife and I had been to church, and we'd just gotten back and were planning to go out for dinner, for lunch rather, and they were upstairs getting ready, and I was down in my living room, and I thought, well, I'll turn the television on and see what's happening. And as I turned the television on, I could hear the voiceover before the picture formed, and somebody was saying in an excited voice, "He's been shot, he's been shot." And I thought, my, what now? And the picture then formed, and Ruby has just stepped up to Oswald as he's being transferred from the police jail to the county jail. And there's a crowd around there in the basement of the police station, and he's shot him in the abdomen. Walked up to him, shot him in the abdomen as he's being guided out by Detective Level on the way out to the car that was going to take him to the county jail. Well, he fell to the floor, of course, and when I saw that, I walked to the foot of my stairway and called up to my wife. I said, I'm going to have to miss lunch because they've just shot Oswald, and I need to go to Parkland and see what I can do to help. My wife called back. She said, "Who is Oswald?" I said, "He's the man they say shot President Kennedy." "Oh," she said, "well, we'll see you later." She was used to saying that. And so I went and got in my car, drove out toward Parkland, and on my way there, I saw a familiar car coming toward me, and it was a car of my chief, Dr. Shires. He had been in Galveston, but he had come back and had also heard over the radio what had just happened to Oswald at Parkland. It's kind of interesting what happened to Dr. Shires where he was in Galveston at that meeting. At a little break in the meeting, he had been out at the coffee pot having a cup of coffee, and Dr. Charles Mayo walked up to him and said, "Tom, do you know what just happened in your city?" And Dr. Shires said, "No, what?" He said, "They just shot the president there." Well, needless to say, that excited and upset Dr. Shires significantly, and he said, "Oh, I've got to get back up there." So the Galveston police put him into a squad car, roared up to the air base just next to Houston, and they put Dr. Shires in a Sabre jet and flew him to Love Field. And he got there. In fact, as Dr. Baxter and I, about 3 o'clock that afternoon, were beginning to explore Governor Connolly's leg wound, we looked up and saw at the scrub sink outside the operating room, Dr. Shires was scrubbing up to help us complete that operation. So he had made a very quick trip in that way back to Dallas. But on this day, on the Sunday that Oswald was shot, we were, informing one another, and he turned around, and we both sped out to Parkland and parked behind the emergency room, ran into the emergency room, and Mrs. Nelson, who was in charge of the nurse in charge of the emergency room, was also there that day, as she had been on Friday when the president was shot. And she said, "Motion to trauma room 2 across the hall from where the president had been treated." And she said to us, "He's in there," knowing, full well that we knew who he was, that is Oswald. So we looked into trauma room 2 and saw that it was a beehive of activity. Oswald was lying on a cart, white as a sheet from having been bled out from his injury. And what happened to him, he might, unlike the president, have had a salvageable injury. But as he saw Oswald approaching him with a pistol, as anybody would, he made what attempt he could to get away from that. Had he not done that, had he not maybe seen Oswald coming at him, seen Ruby coming at him with a pistol, he might not have made an attempt to turn away, and the bullet would have gone straight through him from the front to the back and maybe not caused a fatal injury. However, when he turned, the bullet went across his back and injured both his vena cava and his aorta. And that's generally fatal at the spot, but it wasn't here, the way the blood clot formed. And they got him to Parkland and got him resuscitated, got blood into him, and we were able to operate on him. Dr. Shires was the surgeon, and Dr. Perry, and Dr. Baxter and I, and Dr. Ron Jones, who has been the head of the Department of Surgery at Baylor for many years and has just retired from that. He was a senior resident who was helping us at that time. Well, Dr. Shires made good progress down to those injuries and was almost about to be able to put aortic clamps on those injuries so they could be repaired. Just at that moment, however, Oswald also arrested. So Dr. Perry and I dropped out of surgery, and Dr. Perry opened Oswald's chest, and we massaged his heart, which had stopped, and it regained its tone and began to beat vigorously. We thought maybe this could be salvaged. But then right after that, his heart stopped again. We got it going again, but it stopped again. And we did that 2 or 3 times. And after about 20 or 25 minutes of trying to get it started, it was obvious that it was irretrievable. So he was declared dead. With that, we all left the operating room, went back out to the nurse's station, and Mr. Level, the detective who had been with him when he was shot, was sitting out there, and he said, you know, as soon as he was shot, I got down over his body and put my face in his, and I said, son, you're hurt real bad. Would you like to say anything to me now? And he said, with that, Oswald opened his eyes real wide, looked up at him, and looked like he was thinking for a while. And then he shook his head like that, very vigorously, side to side. No, he did not have anything to say. And he closed his eyes, and that was the last time he ever opened them. It would have been certainly very desirable had we gotten some information possibly from him, but that didn't occur. So he was declared dead. And that was what happened then on those 2 days at Parkland, with the president first and then with Oswald. Now, at this point, I'm going to begin to talk, and I always have to be careful how I do this, because this is a very loaded question. And the first thing I would refer to is the Warren Commission, and then later another group of people who assessed what happened. The Warren Commission was set up by now President Johnson immediately after all of this happened to investigate what had happened and how it came to happen. And very quickly, the Warren Commission, headed up by Chief Justice Earl Warren and several other members, the youngest member of that group was later to be President Ford when he was just a young congressman. And so they assessed this and came up with the conclusion that Oswald was just a lone gunman who was really just a kind of a nobody who decided that for some crazy reason he would come down to Dealey Plaza and shoot the president. And that was the conclusion of the Warren Commission. Well, at that time, at least 3/4 to 80+% of the people in the country didn't buy that. And there was a lot of dissatisfaction with that conclusion, because most people thought there was a conspiracy. There was more than one. It was a more complicated thing than they said it was, the Warren Commission. And because of that, in 1976, Congress set up the House Special Select Committee on looking at the assassination of the president again. And not only looking at his assassination, but now at the assassination of his brother, Robert, who had been killed in the meantime, and the assassination of Martin Luther King, because they thought that all of these assassinations might be connected in some way. So that's what they set up, and they investigated this very closely, from what I've been able to tell, for 3 years, from 1976 to 1979. And then at the end of that time, they publicly announced that in all probability, there was a conspiracy. There was more than one shooter. However, the other kind of intriguing and troubling thing that they said was that we are not at liberty to release the details of our investigation for 50 years until 2029. Now, why this was, I don't think we know to this day why we weren't given all of the details of that. But they did say that in all probability it was a conspiracy, that there was more than one shooter. And so then that was that, in 1979, that they made that conclusion and said they wouldn't release that until the full findings of that until 2029. I hope something will come up where maybe that won't occur, that they will release it for, I don't think the Freedom of Information Act has had any effect on that or not, but anyway, that's what happened, and that's where we stand now. Now, to further comment about that, there are several books that I've got in my satchel up here, that 4 particularly, there have been more than 3,200 books written about various aspects of the assassination. But these 4 that I've got here that some of you later might want to look at, I think are, to me, of particular interest. One of them, the most interesting one, was published about 3 years ago, and it's called JFK and the Unspeakable. And its thesis is that this assassination was set up by the highest levels of the government. In fact, what they say in this book, and I want to emphasize this is not what I'm saying, and this is an apocryphal, not established thing, but the nature of this book, or the statements in this book, are interesting. What they contend is that there were people in the Joint Chiefs of Staff at that time, particularly General Curtis LeMay, who was the Air Force representative at that time on the Joint Chiefs of Staff. And Curtis LeMay was very vocal at that time, this bad part of the Cold War, when we were 4+ against the Russians. He wanted to consider making a first nuclear strike on the Russians before they hit us, back in those early days of the 60s. And on 3 different occasions, President Kennedy thwarted that attack. The first one was at the Bay of Pigs, when they thought they had perhaps an excuse for doing a first nuclear attack. The second one was when the Berlin Wall went up in August of '61, and the third was the nuclear missile crisis, when they were putting missiles in Cuba in October of 1962. On all 3 of those occasions, according to this book, which may or may not be right, may be wrong, may be right, they were thinking that they could make a first nuclear strike on the Russians, and President Kennedy got on the back line, which was fairly new at that time, with Khrushchev. And they sort of poured oil on the water, and nothing bad came out of it. And I remember, as a young man, sitting there watching at 4 o'clock in the afternoon when those boats were shown by helicopter to be bringing more missiles into Cuba, and sitting there watching that, wondering what was going to happen, and how relieved I was, as I'm sure many of you may remember, when I saw slowly those boats bringing those missiles into Cuba make a big turn and head back toward Europe. And anyway, we can thank President Kennedy for that in his talks with Khrushchev. And we had to promise, of course, to move our missiles out of Turkey at that time. A lot of people didn't like having made that deal with him. He knew Lee Harvey Oswald personally, because they had both been stationed at the Atsugi Air Base in Japan, out of which flew the U-2 planes. And I'm sure most of us of a certain age remember that. And that Lee Harvey Oswald, who was a low-level CIA agent, was our radar operator at that base. So much for the idea that he was just some nobody, that he was a low-level CIA agent at that air base. Then the other interesting comment that I had after one of these talks, someone came up to me and said that they had been, a good many years before, this was fairly recently that this happened, but good many years before, they had been in downtown Dallas somewhere at a large cocktail party. And they were standing there talking to John and Nellie Connolly, and that's how they referred to them. And as they were doing that, Nellie Connolly left their little group and went across this big room and stood and talked to a group of people on the opposite side of the room for 4 or 5 minutes, and then came back to our group. And when she came back, John Connolly, as they referred to him, stopped talking and saying what he was saying and leaned down to Nellie and said, Nellie, do you know who you were talking to just now? And she said, no, and said, you were talking to Carlos Marcello, the man who nearly killed me. And he was Carlos Marcello was the head of the mafia in New Orleans for many years. He died a good many years ago with Alzheimer's. And he was apparently the person that they went through to hire the assassins from Europe, from the Corsican Mafia, back when they were setting up to assassinate the president. And these men, according to this story, were hired via the Marseille Mafia, who suggested that they hire 2 men from the Corsican Mafia. And they were flown from Marseille to Mexico City and then drove up to Dallas and stationed themselves behind the picket fence on the Grassy Knoll. And these were the people that a gentleman that I came to know, Mr. Ed Hoffman, I became acquainted with him through the Lancers organization. It's a group of people that have met in Dallas around the time of the assassination ever since the early 90s. Mr. Hoffman and his wife and their daughter was at a meeting of the Lancers organization, and I was invited down to that, found myself at the table with Mr. Hoffman, and Mr. Hoffman had been working at that time, he was a 32-year-old man, at Texas Instruments. And he chipped a tooth that was hurting him, and he asked to be relieved to drive to Arlington to see his dentist. And so they let him off, and he was driving out toward Arlington and got to Stemmons Freeway about the time the motorcade was approaching the Triple Underpass. And they were pulling cars off of Stemmons in order to allow the motorcade go by to the Market Center, where the president was scheduled to deliver an address to a large crowd of people gathered at the Market Center. And so Mr. Hoffman got out of his car to kind of look around and see what was going on, and he was about 400 or 500 feet behind the picket fence on the Grassy Knoll. And at that time, there wasn't all the vegetation between him and the picket fence as there is now. And so what he did, what he saw as he got out of his car, he saw 2 men behind the picket fence. One was wearing a business suit, was standing right behind the picket fence. The other man was dressed in workman's coveralls and was carrying what appeared to be a tool bag. And as he took this in, the man standing behind the picket fence lifted a rifle up that he had been holding with its butt on the ground in front of him, put it on top of the picket fence, and fired it at the oncoming motorcade, and Mr. Hoffman saw it hit the president in the head. And so he said what happened then, the man who had fired that weapon trotted over to the man wearing the coveralls with the tool bag, tossed the rifle to him, and he broke the rifle down, put it into his tool bag, and walked off down the railroad track and disappeared. And just as that happened, Mr. Hoffman saw a crowd surging up toward the picket fence because a lot of people heard what they thought was a weapon fired from there. And there was a big crowd coming up toward it. And at that time, a policeman came around behind the picket fence and came up to the man who had fired the rifle, who of course now no longer had it, and accosted him and clearly asked him for some identification papers. And Mr. Hoffman said the man reached inside his coat, pulled out some papers, showed them to the policeman. The policeman looked at it and nodded, and they then walked out together behind the picket fence and disappeared into the crowd. And then, after having taken that in, Mr. Hoffman parked his car somewhere, got out, ran across to the substation, police station near the area where the shooting occurred, and went in and tried to tell people there what he had just seen. The only thing was they wouldn't pay any attention to him. They thought he was some kind of nut. I haven't told you, Mr. Hoffman was a deaf mute. And in those days, they referred to deaf mutes as deaf and dumb, and with emphasis on the dumb, unfortunately. So they just basically ignored him. And that Thanksgiving, Mr. Hoffman was at his family's Thanksgiving dinner out in Garland, and he thought, well, now I'll be able to get my story across, because his uncle was going to be there for Thanksgiving dinner, and he was on the police force in Dallas. So he told his uncle about what he had seen, and according to the description again in one of these books, he came over to Mr. Hoffman with a very alarmed look on his face and got down in Mr. Hoffman's face and sort of picked him up by the lapels. And he said, "Ed," and he knew how to communicate with him, "you keep your mouth shut or you're going to be killed." And that was the end of that. But I came to know Mr. Hoffman and his wife and their daughter, and I think from that acquaintance that I had of him, he died just about 3 years ago, I think he was telling exactly, truthfully, what he saw. At least that's my impression of him. Whether that's true or not, that's just my impression of him. So those are a number of things that sort of make you think, like that second thing that the House Special Select did, that this was not just a simple lone nut who came down and shot the president, but this was a much more complicated plot to get rid of the president, who was being seen as thwarting the desires to do something like making a first nuclear strike on the Russians. And I think I was not that much of a supporter, wasn't for him or against him at that time, but I'm certainly for him now. I think none of us might be sitting here this evening had it not been for President Kennedy. That's kind of what I've come to for that. I'm sure I've left out some things that I shouldn't have forgotten, but I'm going to stop at this point and see if anybody has a question or a comment. I'll be glad to see what I can do to make a response to that. Yes, sir. That's what Dr. Perry said, and they told him don't say that. And then the next day, let me comment here. The next day, Dr. Perry and I were sitting in our office, we officed together, on Saturday morning, and Dr. Perry got a call from Dr. Oswald from Washington, who was one of the two pathologists who did the postmortem at the Naval Hospital, and he wanted to talk to Dr. Perry about what we had done here in Dallas. And for the first time, he asked Dr. Perry, and I could tell what he was saying because I could hear Dr. Perry's answer. Dr. Perry said, "No, we didn't know there was a back wound." And what he had told Dr. Perry, he said, "Yes, there was a wound in the back." And so then we figured that this was an exit wound, not an entrance wound. And so that's how we got the idea about that. Yes, sir.
Follow up with a question. Was it a different, like save-up bullet in the head? Was it the same size caliber?
I don't know. I don't know the answer to that. And there's some strange things about that. One of the things, there's the unexplained bullet, pristine bullet they call it, that was found on a stretcher, unbloodied stretcher in the Parkland emergency room. Nobody ever explained what that was or where it came from. It kind of looked like to us that somebody had put it there, trying to mislead the investigation in some way. But I don't know the caliber of the bullets. Yes, sir.
Did you tell the cranial area that there's just one wound or any other wounds from the back?
No, I kind of messed things up there myself. When I walked into the room, Dr. Jenkins was sitting there working a breathing machine for the president. And his hands were busy. And as I walked into the room, he nodded toward what I took to be the president's left temple. And he said, "Bob, there's a wound there." And I thought he meant here. And I wrote that down in that little assessment that the Secret Service men asked us to make right after the thing. And then I later found out, by talking to Dr. Jenkins, that wasn't, he meant he was trying to signal that there was a wound. I'm not sure where he was signaling for the wound, but it wasn't in the left temple, and there was no wound in the left temple. But that got into my statement, and I had to do some backpedaling on that when I was quizzed at the Warren Commission by Arlen Specter, was a person who took my testimony for the Warren Commission. Yes, ma'am. How many shots? I think there were the ones that hit him. There may have been one bullet at least that went astray, that actually hit the curb and bounced up and scarred the cheek of some man who was standing down there near the triple underpass. That bullet just went astray. So that was one bullet, apparently. But the two that I know that were there were the one that hit him in the back, came out the front, after we talked to Dr. Boswell, the pathologist in Washington, and then the bullet that hit him, I think, and this is just what I think, about here, and then blew out the back of his head. Now, we didn't see anything there because he had so much hair and his head was so bloodied, and we weren't allowed, or we didn't stay in the room to go over him and his body after he was declared dead. So we didn't see ourselves. But I think that's where the wound must have entered his head and blew out the back of his head. Anybody else? Yes, sir.
Right. When you spoke to the Warren Commission, did they take away from what you said, or did they change it?
No, they've reproduced it as accurately as they could, I think. I was interviewed by our inspector in the administrator's office at Parkland. Dr. Perry, Dr. Baxter went to Washington and interviewed the main committee. But Specter at that time was a young lawyer, unknown at that time. In fact, we're the same age, and he came down to Dallas and interviewed several of us in the administrator's office at Parkland, and did, I think, a reasonably good job of it for about 30 minutes for me, and it was accurately reproduced as far as I can tell. Yeah. Yes, ma'am. The president's brain? Yeah, well, Dr. Jenkins, again, the anesthesiologist who was breathing for the president, when I came into the room, and he was sitting on a stool next to where I was standing at the head of the cart, he said when Mrs. Kennedy first came into the room, as they rolled the president in, after he had been seen by Dr. Carrico and intubated, she came in carrying a large piece of his brain in her hand and handed it to Dr. Jenkins. So, and I saw myself when I was standing at the head of the gurney, the head of the cart he was lying on, the whole back of his head was gone, and the back half of his right cerebral hemisphere was gone. The skull was completely empty. So, in that part of it. Yes, ma'am. Where was what? Oh, Governor Connolly, he was across the hall in trauma room 2. Oh, where was he hit? He had 3 injuries. The worst injury was a large wound in his right chest cavity. And that could have killed him, but fortunately they occluded that across the hall when they were treating him. Dr. Shaw, our thoracic surgery professor, and Dr. James Red Duke who was a resident helping him, they took care of that. Then he also had an injury in his, that was the main injury he had, was that wound in his chest. But when the bullet hit him, it also went through his wrist and into his thigh. And that's what we were exploring, were his thigh vessels. So, yes, sir.
I was pleased to be one of the 12,000 students under you, so I taught you for your years. But when I was a medical student, there was always a rumor that Dr. Cherko had given Kennedy steroids because of his abscesses.
That's right.
Which was always sold a pretty good catch for him.
He's a smart man. That's right.
Not bad, as well as a little bit more about the movie. I know Zac Efron was playing Dr. Cherko. Do you have a character coming up? What do you really think of that movie?
Oh, yeah. Well, an interesting thing about that is that as we were working on President Kennedy in Trauma Room 1, Admiral Bulkley, who was the president's physician, came in waving this ampule of Salia-Cortel and saying, "You've got to give him this." And someone looked at Admiral Bulkley and said, "Oh, he's already gotten that." And Dr. Carrico had had the presence of mind and the intelligence to know that he had adrenal insufficiency and had given him that hormonal treatment at the same time he intubated his trachea. Smart man, very smart man, Dr. Carrico was. Yes, sir.
Did you ever feel in danger or anything while you kept hearing all these crazy conspiracy things? Did you ever feel like
No. Maybe I'm too dumb to but I felt like this was so widely known that I didn't know anything that was not generally known. So now, granted, Dr. Perry was basically threatened, as this book said, and I think that's probably true, particularly since I know that even to me, as close of friends as we were in the office together, he would not ever talk about it. Because I think, as that book said, he had been warned never to call that an entrance wound again, which it wasn't. It was an exit wound, I think. But they didn't want anybody to think that there was another shooter from the picket fence. Yeah. Yes, sir.
You got, President Kennedy got shot in the back, from the back.
Yeah.
Got shot, from the
Well,
front.
let me correct you a little bit. The wound here, which I think was an exit wound, hit him high in the back and came out his neck. Yeah, right. Mm-hmm. Yeah. So, yes, sir. No. The only one that I know was warned like that was Dr. Perry. I don't know of anybody, none of the rest of us were ever said, keep your mouth shut or anything. That was never done. So, yes, sir.
Your view of the events, as you portray them, your judgment of what happened, have developed over the years, as you've heard more and more and met other folks. I'm curious, at the time, when you publicly did you have a view of what happened? Were you, like the rest of the country, just trying to make sense of things? How did you make sense of things?
I was uncertain fairly early on that it was not just Oswald. And as the years went by, various things convinced me more and more that Oswald was not just a lone nut. He may have been a nut, all right, but he was not a lone nut, and that he was a part of a fairly complex plot. Yes, sir. What about the bullet? Oh, no. Unfortunately, it wasn't. And I'm party to a mistake there, because when we were exploring the governor's thigh wound, all we were looking at is the femoral artery and vein and trying to be sure they were, and you normally don't go digging around for bullets because you cause more damage than you help that. So we didn't, but we could have and should have I think in this case, have tried to retrieve the bullet, which probably was near where we were in his thigh wound. And I regret that we didn't maybe probe a little more around and try to find that bullet if we could have. Well, thank you for your attention, and I hope I've not burdened you with too much here. Thank you.
There are refreshments in cheesecake over here if you want to stay, and I'm sure Dr. Mack wouldn't mind answering a few questions if you have them for him. He also has somewhere here the shirt that he was wearing covered with Kennedy's blood still in his possession.
Let me briefly talk about that. When I went in to help treat President Kennedy, I had on just my suit. We didn't have time to change into scrubs or whatever. So I was totally soaked in the president's blood. So that evening when I came home, I took my suit off, and the next day my wife took it to the cleaners. And he recognized what it was, and she said, "You're going to have this thing cleaned?" And she said, "Well, my husband only has one other suit." And so they cleaned the suit, but I did have the presence of mind to keep the shirt that I had on that had the blood stains on it. So can you unzip that? I'm not sure what compartment that's in. Yeah, there it is. This is what was the remnant of that. And so that's nothing like the blood that was covering all of my suit. And I had an interesting and strange request, again, probably within the last year. Some gentlemen came by to visit me, and they wanted me to take this shirt to a lab and get it tested for DNA and show that it was not the president's blood. They had a theory that it was not Kennedy who was shot, but was a ringer for Kennedy who was shot, and that the actual real Kennedy was spirited away to an island in the Baltic Sea. And they wanted me to take this shirt to a lab and show that it was not Kennedy's blood. And I told them, well, gentlemen, I have essentially no doubt that this was his blood, but they wanted me to do that. That's a strange sort of request. Anyway.
Thank you, Dr. Mack.
Yes, sir.
So, refreshments.
Yeah.